I'm Dr. Leena Jain, plastic and reconstructive surgeon from Mumbai. You're here at Plasticos Clinic, Borivali. Today I'm going to talk about hemifacial atrophy. It is a common condition, not much spoken about, but it's a very interesting condition to treat. When I say hemifacial, means one side of the face, and atrophy means underdeveloped. So this is not something that is present at birth, but it presents later in life, either in the age group of 10 to 20 or in the age group of 20 to 30. So basically it's a developmental condition. Why does it happen? There is no clear-cut reason. Often there is a triggering factor like a small injury, patient falls during childhood, and as the child develops, then one half of the face is flatter and underdeveloped or smaller than the other side of the face. There is a syndrome called Romberg syndrome which has been associated with this condition. So what are the parts of the face commonly affected? It is usually the mid face. So the part of just below the eyeball, the cheek area, which is most commonly affected in hemifacial atrophy. It can go down to involve the lower jaw also. Often the forehead or the scalp are not affected, or the ear is also not affected much. There are different stages, or you can say grades, of hemifacial atrophy. So like I said, sometimes children present at a very young age, like 10 years. So they have a very severe form of hemifacial atrophy, wherein a lot of skin, soft tissue and the bones are also retarded in their growth, so that the entire half of the face is practically flat. The second is a moderate kind of hemifacial atrophy, wherein some amount of the soft tissue is of course affected, but even the bones are a little underdeveloped. And then the final one, which is the mildest form, these present usually in adulthood, like after 25-30, when they notice that one half is a little underdeveloped. So this is mild form, wherein the bones or the skeleton is practically intact, no difference on both the sides, but the soft tissue or the fat is quite atrophic or quite thinned out. So how does one treat this condition? Of course, surgery is the only answer to treat hemifacial atrophy.